and I lead the Innovation Incubator here at Coram. Today is one of the webinars that we deliver for anyone who's interested to come to our sessions, and we record these and make them available on our website so that anyone who's not able to join us can watch it back at their leisure. Our webinar today is focusing on a key issue across the sector about how we can best meet the needs of children with special educational needs and disabilities, and more specifically how local authorities can strengthen the processes which facilitate SEND support and meet their statutory obligations. I'm delighted that we're joined today by Kaylin and Phil. Kaylin is at faculty and Phil from Innovation 360, who've been working on improving services in this area. Kaylin has 10 years of experience working with health, education and social care data in schools, in the local authorities and at national level. And at faculty, she leads its partnership with Genomics England and now oversees 2 machine learning products used by over 1,000 frontline NHS practitioners. Phil is the founder and CEO of Innovation 360, which supports local authorities and integrated health boards through digital solutions that focus primarily on quality assurance. So Phil worked in children's services for 20 years in educational and child psychology, primarily within the SEND area. And today, Kaylin and Phil are going to showcase 3 innovative tools that have been developed to allow local authorities to provide better support for children and young people with SEND, as well as detailing some new opportunities to improve service delivery. So we hope that what you're going to hear about today will inspire you. You'll have questions, I'm sure, and there'll be opportunities for discussion and questions towards the end of the session. But not just about what they're going to talk about today, but if you have other ideas or thoughts about actually what can we be doing better in this space around SEND. The DFE had a review last year, I think it was, I lost track of time, and a strategy that they're putting out, but we know that there's still a lot more that could be done in terms of meeting the needs of many children and young people in this field. So I look forward to a really interesting presentation and a really good discussion later on. Who's going to go first, Kaylin or Phil?
I think I'm going to kick off, Kevin.
Thank you.
Okay, well, afternoon, everybody, and yeah, thanks for attending. So the aim of the session today is really to give you some insight into the work that Envision 360 have been doing and some of the work that we're proposing we'll engage with, and that's where faculty come in. And Kaylin, what I'll do is I'll start by just sort of introducing ourselves. There's going to be a small amount of engagement during the talk if possible, so if you've got a phone or a tablet or a device nearby, it'd be handy, and you can obviously use the desktop you're on, just to get some anonymous responses via a platform, but I'll explain all as we do it. So firstly myself, so as Kevin points out, my background has been largely in the field of children's services and special educational needs disability. I was an educational psychologist for a number of years. Prior to that, I was a teacher, and then following that, I went on to work internationally for a small period of time before returning to the UK and working as a principal educational psychologist and head of inclusion services for a number of London boroughs. My last local authority post would have been in the London Borough of Barnet, and that's where Kaylin and I first worked together. And so I was head of inclusion services and principal EP, and I helped oversee their quality assurance framework. And about 2.5 years ago, 3 years maybe now, I left local authority work to begin Envision 360 and what I felt were some digital solutions to improve the outcomes for children and young people with additional needs at any vulnerable cohort. And yeah, we'll give you a little bit of insight into how we're trying to achieve that, how we hope to achieve it in the future, and we'd be really interested to hear people's thoughts and any sort of queries and suggestions on how we can explore new and exciting areas. So at this point, I'll just hand over for Kaylin for a quick intro.
Yeah, cool. Hi everyone, it's lovely to be here with you today. So as Phil and Kevin mentioned, my name is Kaylin. I'm currently a senior manager at a company called Faculty. which is a data science company who work with lots of different organisations, both within the public and the private sector. And our kind of like main aim is to apply some of the like latest, like most cutting edge analytical techniques to help solve lots of difficult problems that different types of people are working on at the moment. It's meant that we've gotten to get involved in some really cool areas over the past couple of years, slightly sad areas as well. So part of our work over the last 2 years was actually working with NHS England during the COVID pandemic. And we worked with NHS England to develop something called the early warning system, which provided a 3-week view of how many patients were going to be admitted to every hospital in the country. And this was used for some really key decisions over the last 2 years, from like lockdown decisions, but also moving patients between hospitals to make sure that no single hospital actually got overwhelmed during the pandemic as well. Prior to working at faculty, I had started off working in a school in Croydon as a school data manager before moving to Barnet Local Authority, where I met Phil and worked in a few different roles for 5 years or thereabouts. And that kind of cut across education, SEND, and kind of a bit of social care as well, doing quite a lot of direct work with schools and governing bodies, and like delivering a lot of training across the local area and in some other local authorities across London as well. I then kind of slowly shifted towards the health sector, and that included working for 2 years in NHS England during the pandemic as well. So I'll hand back to you, Phil.
Thanks, Kaylin. Okay, so how the session we've designed it is that we'll deliver some slides and some information, and then we'll leave a considerable amount of the percentage of the session for us to have some dialogue with participants, questions, Q&A, and respond to some queries. But before we go and deliver some information, it's always useful, if possible, I'm just going to share screen to get a little bit of insight into what people are hoping or expecting from the session as well. So hopefully my screen's sharing. And what I'm going to ask you to do, if possible, on any device that's connected into the internet, if you could just type in your browser, whether it's Google or Microsoft Edge, just Menti, MENTI, and you'll get to the top one, or one of the top ones will be join a presentation. And if you could select that, it'll then ask you for a code, and the code's on screen here. So it's Menti in your browser, join a presentation, and then you've got a code, and I'm just going to pull the code up and start with a quick, and all the answers are anonymous. They'll come up on screen, but nobody will know who said what, so do feel very comfortable to write what you think. And the question is, what do you hope to get from today's session or webinar? What would be something that you'd like to get from it? The code's on the top of the screen, which is hopefully sharing, which is 1280 6656, and just to get a little bit of an idea what people hoping to get from today. Okay. Okay, fantastic. Okay, we can revisit these at the end, as you can continue to put them in, but it's really nice to see some of the things that are coming up. One of the first things, which is great, is ideas, more insight, more ideas into how are other areas supporting children and young people with SEND? What can we learn in? Where's the cross-learning? There's a point here about social care, health and education in terms of partnership working. We'll definitely be touching on that today, because that's a big need, and it's a big drive, and lots of local areas are doing it, and some are doing it incredibly well. Other areas are still on that learning journey for there. We've got a query about measuring outcomes, which we'll definitely be touching upon as well, and others just around expanding your knowledge in this area. Fantastic. Okay, so at this point, I'm going to go to my slides. Okay. Kaylin, you need to just let me know that everybody can see. So hopefully now your screen should have slide 1, which is just Kaylin and I saying hi as Envision characters there. Okay, fantastic. Okay, so firstly, who we are. So in terms of Envision 360, Envision 360 was an organisation I set up 2 years ago, and we're essentially providing software as a service. It's a digital solution or a digital tool to support local areas, and essentially with the main outcome in terms of improving outcomes for vulnerable children and young people. My background is in SEND, and the first concept and the first tool we built was a tool to help quality assure audit an education, health and care plan. I'll talk a little bit about what that is in a moment, because that was where my personal background was from. I've got a brother with complex SEND needs. I've worked my entire career in SEND, and I felt there was a real opportunity to improve the quality of EHCPs, and that was what the first tool was designed to do. Due to the success of that in a relatively short period of time, and when I mean the word success, I mean in terms of the number of local authorities beginning to engage with it and see impact and progress, we were starting to be asked to build other tools in similar areas, and we've now got a suite of 4 tools, but hopefully that will soon be 7 tools, all looking at different areas, some largely in SEND, others looking at different areas as well. And as I go through the presentation, I'll talk a little bit more about that. Our aspirations as a company really is to improve, like I say, children and young people's outcomes, but by doing that through tangible mechanisms, by allowing technology to create more efficient ways of working and to provide more time and capacity for the so what question. So our data or our intel or our information tells us this, and we've collated that. So what? So what do we do with it? So what is the difference it's going to make to children's lives? And a lot of the time, a lot of time and capacity is spent on the process, the data collection, the data analysis. And we feel actually that tools to do that and provide that time back to local areas to really get hands-on in terms of improvement journeys. As I think somebody put in the comments at the first in terms of aspirations, the world of education and social care and health is, like many others, there's more to do with less resource to do it. So capacity is huge. It's the biggest challenge. People's time, resources to be able to support in this area are stretched to the nth degree. And that's problematic because this is some of our most vulnerable community or cohorts of young people that we're working and supporting. So what we try to do is build something that is efficient, that increases capacity elsewhere, that doesn't put a huge demand or a strain on local authorities to access what we're trying to provide. And I think the fact that I was frontline and worked and led these services for a period of time meant that we had an understanding of that capacity and the demands. But as we continue to work, we work really closely with lots of local authorities to make sure that we really have that frontline knowledge and insight. So the focus for the session is to talk through what we offer, and we're going to do that firstly through a vehicle of one of our tools. So we're going to use the EHCP tool to show you the journey we went on and what that tool looks like and what it does and how it's being utilised. Then the latter part of the session, Kaylin's going to introduce an exciting new project that we're looking to do that can have a huge impact on resource for local authorities around forecasting for local from local areas. Okay, so the problem we're currently solving, as we've said, it's a digital solution to improve outcomes. And our focus is quality assurance, as Kevin rightly said at the start of this session. We're focused on quality, and we're particularly looking at the ability for partnership or collaborative work. And again, that's someone put in the opening slide in terms of feedback, that ability to work across education, health and social care, both consistently and really productively as well. So let's use one of our tools as a vehicle on how we identify an issue or a problem and how we go about providing some services or solutions for that and the difference it can make on the ground. Okay, so the first tool or the first module we built was the Education, Health and Care Plan module. Children with complex special education needs and disability will access an education, health and care plan. And that's around 4% of the entire population of children and young people in England would have an EHCP. Now, an education, health and care plan is a statutory document, and that provides the support and the wraparound care and identifies what support is required to meet that child's needs and to monitor and ensure successful outcomes. Now, we know that local areas are inspected for their delivery of SEND provision, and we use local areas, not local authorities, because it's education, health and social care and the community. And we know that the Ofsted and the Care Quality Commission have now conducted all of those inspections over a 5-year period. And we know over half of local areas inspected didn't meet the requirements in terms of expectations and had to produce what's called a written statement of action, an action plan on how they're going to address their areas of weakness. The more recent inspections that occurred, because we would hope that we would see improvement over time with that inspection framework, but in the 2021-22 cohort of inspections, it was almost 7 out of 10, 68% of local areas that were inspected were required to produce a written statement of action, i.e. there were gaps in what the SEND provision and the SEND offer was for their community, which is hugely worrying, regardless of capacity and resource, that expectations are not being met nationally for a large number of local areas. And from those significant weaknesses, where there was 440 identified across all areas, within the top 3 of those was the quality and consistency of that statutory document that's there to support children and young people, SEND, the Education, Health and Care Plan. So we knew that this was a national problem, that the quality and consistency of these really vital, important statutory plans is not at the level it should be. And local authorities traditionally had been assessed on their ability to get those EHCPs out in a time frame, the statutory time frame, which was 20 weeks from an application being made and agreed to having that EHCP, Education, Health and Care Plan, implemented and with the child in the setting was 20 weeks. And because local authorities were working really hard to hit that 20 weeks, there was a theoretical assumption that potentially quality on occasions was not as focused upon as it should be. Okay, as we talked about, 4% of the children and young people in England have an education, health and care plan. The other reason this is a really important area to look at, one, we know the quality and consistency is a weakness, but we also know the number of plans being that are out there for children and young people is growing year on year. There hasn't been a year since they were introduced in 2015 where they haven't increased the number of EHCPs out in the community. The orange on the graph refers to statements. Statements up until 2015 was the term used for a statutory plan around a child. With the SEND reforms 2014, that was replaced by an education, health and care plan to be more collaborative across health, social care and education. But so we know that there's an issue in terms of the resource and demand. We know the number of plans are increasing year on year, and we know from Ofsted and CQC that the quality and consistency of those plans are poor. This is really starting to create a red flag, and we feel that actually local authorities, from the work we've done, were all managing their quality assurance framework internally. So a local response. Some had quite a robust response, others had no response to quality assurance. And there was a huge spectrum, and we felt producing something standardized, producing something where you can compare your local authority to wider local authorities against solid criteria, more objective criteria, would have the result of, one, creating more consistent auditing, and two, identifying where improvements need to be made to ensure that these children and young people are getting the plan they deserve and achieving the outcomes that they're capable of. Okay, so what did we build? We built an online step-by-step tool that allowed people to audit an EHCP across a local area, whether that be someone working in SEND, or whether that be a school, or whether that be a parent carer, or whether that be a frontline health professional or social care professional. They were all able to audit a plan in its entirety by the way the tool was built and designed. Increasing the awareness of what does a good plan look like, but more importantly, what does a good plan look like section by section, and that ability to benchmark against other local areas. So I'm going to show you the Education, Health and Care Plan Audit tool. I'll give you a very, very brief demo. Okay. Here we go. Okay. So is the login page now on, Kaylin? Okay. So we built a cloud-based tool to audit plans. So local authorities, doesn't matter what case management system they're using, doesn't matter what their EHCP templates look like, they could all use this one cloud-based tool without having to download or implement any software into their existing systems. So how the tool works, from an auditing perspective, what it allows people, the local authority to do, local area, is to disseminate audits across the local area. And it's a vehicle for auditing the plan. So the plans don't live on the tool. It's all done through a unique ID. That unique ID means that no child's name or date of birth, etc., goes on the tool, but every audit can be linked to every plan and every child. And how the tool works, and we've got a couple here that are logged in or have started, is that has each section with, so it's a statutory document, it must have all of these sections within an EHCP, regardless of where you live in the country. And section by section, the tool allows an auditor to go through and use criteria that was drawn down from nationally recognised good practice documentation by a steering group and audit the quality of EHCPs. And we'd have auditors with all manner of experience or engagement with SEND. So they would know that here we're on section E, which is the outcomes for the child. Then the auditor has prompts. So what does a good section E look like? How do I choose the correct criteria? All of these prompts are inbuilt for that step-by-step process. And then as the auditor selects some criteria, and like I say, they're under bandings from outstanding, requires improvement, good and inadequate, the tool begins to grade that section of the plan. And so the individual auditor can't say subjectively or anecdotally, I feel that this should be a good section E or an outstanding section E. The tool will make that decision in a standardized way. And then it allows the auditor to leave comments, to identify strengths, to identify areas to improve. And they move through the tool section by section. Once they get to the end of an audit, they're able to then put some actions that they think should happen as a result of reading that. And these are, you can put any actions at all as a reading that EHCP and auditing it. And for every audit that's completed, the tool creates an audit summary that can be shared with schools, settings, parent, carers, professionals that says, this plan was audited, here's the overall grading, this is who audited it and what date, section by section grading, all the criteria selected, and all the comments for improvement work. So it's all listed in there. From a local authority point of view, what it does is they disseminate the work across the local area, and they have a live window then into the quality of their EHCPs, and they can explore that data in all manner of ways. So they can look at it section by section, they can look at particular age groups, particular cohorts, particular ethnicity, and see where they need to target improvement work. The improvement work can be targeted by looking at the comments auditors are leaving section by section. And they can run touch of the button reporting by putting any date period in, any filters, running a report, and getting a summary of the distribution of gradings overall, section by section, and auditor's comments. Again, touch the button, taking away all of that work for them that they can then complete. And finally, what the tool does, which is one of the features that local authorities really enjoy, is the ability to benchmark. We know 34 local areas are using this tool, so I can compare my data and our local authority to the other 33 anonymously. And I can do that overall, or I can do it section by section and see where our relative areas of strength and weakness are. And from that, again, I can run reports that I can share across the community about where our local authority stands in comparison to others. No longer a locality-based tool. Okay, I'm going to go back to the slides. I had a small video to play, but unfortunately, when I go to include sound, it's no longer working. So what I'm going to do is you can watch that video at the end. It's only 2 minutes. I'm going to drop it into the chat. Kevin, if I drop something in the chat, will everybody be able to see the link? So I'll drop that video in the chat. And what that is, it's a 2-minute recording that a local authority themselves have made about their experiences of their improvement journey with the tool. It's, like I say, it's just 2 minutes long, and it's on their the local authority is Knowsley in the Northwest, and they put it on their website. So it's them talking about the tool. I've dropped the link into the chat. So Kaylin, when it does drop in, just click it and make sure it does take people to the right page. But feel free to look at that at your leisure. But it's quite nice, rather than hearing it from myself, someone who's embedded in the company, but to hear it from a council and a head of service saying this is the difference it makes. Okay. So let me come back to a full screen. My laptop is catching up. Okay. So we've had a very brief look at the Education, Health and Care Plan and the ability to benchmark. On our website, envision360.com, it talks about all the local areas that are working with us. So you can see if your local area is one of those who are engaging with the tool. And we're now, like I say, in over 20% local authorities. That number is growing month on month. We've had another 4 local authorities just agree to join us now this next week or 2. So the number's growing. We're expecting that percentage to rise quite significantly. And obviously, as we're seeing more and more impact, we're seeing more local authorities approach us to see what is the solution others are using and can they engage with it. This is the link I talked about, so you can watch that. I'll also share the slide deck as well, Kevin, so you can then disseminate with people, and that has the links. And what has been the impact? Well, we're seeing the percentage of plans good or above increase significantly, 30% last year of those local areas using the tool. And that was a further 11% increase from the year before. So year on year, we're seeing improvement in terms of the quality of plans. There's lots of case studies on our website about individual local authorities and the improvements they've made overall and section by section. We're now seeing ourselves cited in Ofsted and CQC local areas send inspection letters. Every time a local area is inspected by Ofsted and CQC across education, health and social care, they produce an outcome letter which gives you the findings of their inspection. And we've now seen Envision cited, they reference us as an external partner, but they've seen that we're seeing comments about local areas being visited and saying the robustness and rigor of their QA frameworks has seen huge improvement. We're seeing now, this is another example about how leaders across the community in schools and earlier settings had seen or noticed considerable and recent improvement of the quality EHCPs. And we're seeing local authorities being nominated for awards based on their improvement journey. So we're seeing real impact. We're still focusing here on our EHCP tool. And the new inspection framework was released or published in November last year, just a couple of months ago. 29th of November. One of the focus areas is the local areas partnership approach to the oversight and QA of EHCPs. And obviously that we're seeing that's exactly where we're positioned to support. I'm going to really briefly talk about this before handing over to Kaylin. So I've given you an example of our journey through the Education, Health and Care Plan tool, but we've now built other tools. We've built an annual review audit tool. We built a tool that was commissioned by the NHS That was piloted in November and December last year and has just been launched in January this month. And that's quality assurance health advice that's submitted to local authorities for children with SEND. So that could be a consultant paediatrician, a GP, a speech and language therapy service, but we have a distinct module for that. We've also built a tool in the realm of children in care. Children in care all have a personal education plan, and we built an audit tool in that area as well. Before I talk about future projects, I'll just show you really super briefly some of the differences or some of the features of the other tools. So we've now started to incorporate children and young people's feedback in our tools. So the tool provides links for children and young people to be able to share their feedback and their experiential data. So local areas are now getting experiential data. Did people feel included in their meetings conducted by local authorities? Do parent carers feel that there were positive outcomes? Did they feel like there were clear next steps, that they were valued, that there was purpose? Did children get feedback from the outcomes? So a big focus on children and young people's voice. Somebody said earlier around outcomes monitoring, one of our tools now does exactly that. It monitors children's outcomes, so their progress towards those outcomes. And again, you can benchmark the progress of children and young people's outcomes in your local area against other local areas. You can do that by age group, by primary area of special need, by setting type, and so forth. And then just before I pass over to Kaylin, the future projects on the right-hand side are what we're looking at engaging in. And then we have plans, or a roadmap, we call it. So we're building a psychology advice audit tool. Kaylin's going to talk us through the SEND forecasting tool that we're proposing to build, a safeguarding tool, and we're now looking to step into social care, and we're looking at our first module being about children and young people transitioning into adult services. Kaylin, at this point, I'm going to pass over to you to talk a little bit about our SEND forecasting tool.
Yeah, cool. Thank you, Phil. So if you just want to go to maybe the next slide, that's really helpful. Cool. So Phil and I have known each other for a number of years, and we kind of worked a little bit together on some of the previous quality assurance tools, and we were kind of keen to find another way to work together, both as kind of Envision 360 kind of has continued to grow and expand the number of products and its links with local authorities, as well as kind of potentially being able to draw on some of the technical skills that we now have access to at faculty as well. So this kind of made us really have a bit of a think about problems where data science could help make a difference to local authorities, and specifically the kind of special educational needs and disabilities space as well. I'm not going to go into the detail around all of the different data science techniques that exist, but we did have a bit of a think about some of the different applications of data science. And we were particularly interested actually in kind of applying some of the better forecasting techniques that you could use to forecast the number of children and young people with SEND that we expect local authorities to be identifying over the next 3 to 5 to 10 years, and breaking that down by things like age and primary need as well. Part of the reason why we were really interested in the kind of forecasting space is because once you have a clear idea of how many children and young people with SEND you will expect to kind of be identifying, this kind of has a lot of different applications and can apply to a lot of different kind of problems or decisions that local authorities might be facing. Like 2 specific examples might be wanting to know how much health provision you should be commissioning over the next few years, and also kind of for what types of primary needs or what kinds of health requirements are going to be needed, and how will that change over time. And then like another example would be kind of what caseworker staffing profile will be needed to support the future demand for either new assessments or annual reviews, and how could you potentially think about structuring your caseworker team to best meet some of those changing profiles. So after kind of looking through all of these different areas, we decided to focus on what these forecasts might mean for school place planning. If you want to go on to the next slide, Phil, thanks. And one of the reasons why we made this decision is because it is something that we have quite a lot of internal expertise for. So when I was working at Barnet, I also did a role as school place planning officer, and also liaised across like the Greater London Authority about kind of some of the school place planning interdependencies across a larger complex area. We also know that forecasts for SEND are likely to form part of the DfE statutory school capacity return in future, and we wanted to make these sorts of things just much easier and quicker for LAs to be able to complete and do. And then we also know that school commissioning, especially specialist places, accounts for a significant amount of expenditure for local authorities. So we think it's really important that that is used as effectively as possible. So the project we developed is based on building a set of SEND children and young people forecasts using some of the latest machine learning techniques alongside existing and planned school capacity, which should help LAs to see where the shortfall or surplus of places might be, and also help to plan some of their school place planning commissioning arrangements into the future. Part of the reason for this is that we think this information could do a few different things. So first of all, help improve the quality of provision that children and young people can receive in their local area by making sure that the local provision is kind of mapped to the future needs of the SEND population. To also help reduce some of the costs of out-of-borough placements, which can be very significant for many local authorities. I think, much to Phil's point, teams are already really busy, so we wanted to kind of make some of these place planning tasks as efficient as possible for local authority teams, and also to kind of support some of the joint working between education, health, social care, and also central government when there are discussions about kind of budgets and funding pots and everything like that. In practice, what this means for kind of what people would see once we've kind of developed this project is that you would be able to see kind of the forecasts presented in some dashboards. They would show the predicted number of children and young people with SEND, likely broken down by things like primary need, national curriculum year group, over different time horizons as well. We would aim to kind of show under and over provision of school places against this forecast. And then also provide you with a couple tools that allow you to sort of add or subtract school capacity so that you can basically create your own scenarios that could help you to decide how many temporary or permanent school expansions you might want to make, and kind of at what point in the future you might want to bring those on live or on stream. Next slide, please, Phil. So I guess we've done quite a lot of thinking about this and have been doing basically some kind of desktop assessments to think about what sort of information we might need. And I think obviously the more data we're able to draw on, that would make the forecast both more accurate, but also a bit more precise as well. And then we also know that we would need to work with local authorities to capture their forecast plans for school places alongside that. I think just basically this slide is mainly here just to kind of demonstrate that we've given a bit of thought about which data sets would be most useful for forecasting. And that might range from some of the publicly available data sets right through to making sure that we do tailor at a local level to your specific context as well. I think next slide, Phil. Cool. So I think this definitely wasn't a sales pitch in any way. So I think mainly what we're aiming to get from this is just a bit of feedback about whether you think that sounds like an interesting project, whether you think it does have potential applications for different areas, and just basically get your thoughts on whether there are any other ideas that you think would be helpful for us to explore.
Yeah, thanks, Kaylin. So yeah, at this point we've sort of come to the end of what we were planning on delivering, and we wanted to use the remaining space in this meeting, exactly what Kaylin says, gather your views, answer any queries, any feedback whatsoever. So over to you guys. So I don't know if people want to use the hand up function on Teams and we can go around.
Thank you both. I guess as an open question to people who are attending, based on what Kaylin's just shown, how are forecast, or do you just sort of go with the flow and see what comes forward? And in terms of what Phil presented, how are you doing that quality assurance right now? And what other areas actually are you struggling? Quality assurance is important. You need to have a good quality EHCP plan in place. The next step after that is delivering on it and actually fulfilling the commitment that you're making to the children and their families and so on. So what are you doing there, and where do you see the struggles are, the challenges are, and what could help? Carolyn.
Hello. Never want to feel comfortable in silence, so I'll chip in. I'm Caroline Penfold. I'm the head of Children and Young Adults Disability Service from Havering, and as such I manage social care for children with complex needs and also SEN. Starting with the forecasting, we spent a lot of time. We've got some wonderful people in our school organisation team that have over the last few years refined how they're doing their forecasting. We have got closer and closer, so that every year when we do our actuals and we plug in our actuals and we look to see what we were anticipating, we have got closer and closer. It was wildly out about 5 years ago. Then every year it's got more refined. But what we're finding now is that so many different sort of demographic changes, the increased numbers of children moving in to Havering being that last borough on the right hand side before you hit Essex, which had cheaper accommodation, etc. Not so much now, where gradually people were moving out. So I know that the guys have found that really difficult to try and keep on top of changes in demographics which nobody forecasted. We can refine it, year on year and go, oh well, look, the actual number of children that we've got or families that have moved into Havering have shifted the proportions that we're expecting with SEND, and so therefore, etc. But do you have any sort of views, I suppose, guidance about how you do that? Is there a sort of natural override that you can put into your system with regards to population changes? I'm not a statistician person at all. When they tell me how they've calculated it, I just go, oh, lovely. What does it tell us?
So it's difficult for me to know without kind of knowing exactly how your team are working at the moment. I would sort of say that it's a common challenge, and obviously one of the things that, like lots of local authorities, will probably find difficult is just accounting for all of the different factors that do affect some of these numbers, and some of which can be very small if you are trying to forecast at a primary need level by a national curriculum year group, especially when you're looking at like nursery 1, nursery 2, you might only be forecasting very small numbers.
Well, we don't go down that low in terms of that's a good point actually, that you're raising, that in fact your tool can look at sort of different things. And when we think we've done quite well with primary, secondary, special, primary needs, secondary needs, and I don't think we can do any more than that.
Yeah, I mean, I'm happy to, like, if it's helpful, happy to have a conversation with your team at some point in the future, just to understand a little bit more about how it is that you are doing it. But I guess one of the advantages of potentially thinking about more machine learning or other advanced kind of forecasting tools is that you can typically work with a lot more data sets, and you can tend to uncover a lot more complex relationships that might not necessarily be incredibly obvious if you're kind of hard coding them into the start of your analysis. So it's just another perspective, and obviously I'm not saying one is better than the other. It's just really dependent on what's right for your organisation at the time, but that is one of the benefits of using more advanced analytical techniques as part of it.
Thank you.
Thanks, Caroline.
Yeah, and it's good that you've managed to get something. Forecasting is difficult, and it's good that you've been able to get to a point now where the forecasts are getting better. And I know most local authorities will struggle with that, and they will end up developing something themselves, partly because they all face slightly different circumstances and demographics and so on. But the aim of this is to try and where we can share learning, share insight, so that you can all improve what you're doing and help you deliver your services better. So thank you for that, Caroline. Any other questions or comments or thoughts?
Can I just, I just didn't put my hand up. Sorry, it's Rachel from the city.
Hi, Rachel.
Hiya, we're so tiny it's not really applicable for us, but I'm just interested. We do obviously QA our EHCPs quite rigorously independently, but I'm just interested. So do you do the audits? Who does the audits, or is it the independent people and then uploading it? So do you have a standard benchmark for what's outstanding in an area, or etc.? Just curious about that bit.
Yeah, no, it's a really good question. So whenever we build a tool, we build it with a number of local authorities to make sure we've got that front line sort of expertise. So we utilised as much information that was out there when creating the criteria. All the nationally recognised good practice documentation out there, Council for Disabled Children, IPSI, Aspire, and so forth. Put a criteria together, piloted it, refined it, and now out there now, because we're having thousands of audits run through the system, where the tool keeps improving, because obviously we're getting constant feedback. In terms of how, there's a good question about who audits. So the tool was designed that local authorities and local areas complete the audits. It's designed so that you spread the demand across your local area and you get that information. So you audit across your local area. Small number of local authorities recently have come to us and asked us, could we provide a service to provide some auditing on top to give them a baseline of data to supplement what they're auditing. So we've begun to do that for them. That wasn't a plan at the start, and that's something quite recent. But again, just purely down to capacity. But 90% of local areas who utilise the tool, they audit the plans using the tool. And like I say, it's designed that you don't have to have a lot of engagement or specialism in education, health and care plans, so it's not a send service task. This is a local authority or local area task that can be disseminated across your professionals. Does that answer the question?
Yeah, it does. I mean, a way of making it forward, if I was needing the service, I guess, would be your local authorities to audit each other. So like a peer-to-peer, so it wouldn't cost anything different, and you'd have like maybe 20% of your audits done by somebody else, and then you're not paying an external. We pay an external agency, so it's independently rigorous. But actually, why not do each other's, and you're not doing any more or less?
That's exactly what's organically come out. So so local authorities, like you say, what they do is they keep their own data set within their system. But when they've come together, so some local authorities are connected for various reasons. We've created like an extra account for them, which is their peer moderation account, so they can go in there and peer moderate, and they get that really data.
Strong, isn't it?
Yeah,
because a lot of independent auditors are making a lot of money. Ex-Ofsted colleagues setting themselves up as auditors and supporting. That's a big business. Whereas actually, if we could support each other doing that, that would be stronger and save the arm and leg that probably goes by the way for the ex-Ofsted peeps who are making shed loads, hundreds of thousands each a year probably.
And the other thing that we've created now, because the benchmarking data is there and it's live, we're creating workshops as well. So local authorities, so those who have got strong, for example, in various sections, let's say social care advice coming in, they can talk about what infrastructures they've put in place to achieve that, and they can learn from other local authorities why their section F on provision is so strong and so forth. So that shared learning is a big part of what we're trying to do.
Fab. That sounds great. And if it cuts out some of the independent audit money we spend, it would be great. Much rather spend it on children.
Absolutely.
Yeah. Thanks, Rachel. Okay. Any other? Oh, yeah, Rachel. Other Rachel.
Hi there. I was just two questions. I was gonna ask, is there an option to then moderate as well within that tool? So can you have auditors and then someone to moderate the findings? And I was also going to ask if it kind of takes into account the quality of the advices as well that are sort of with the plan. So is it just auditing the plan alone, or is it sort of looking as well at the advices that have contributed towards making that plan?
Yeah, good questions. I hopefully can answer both of those. So one, the tool has a moderation feature built in. So if I assign an audit to Kevin and Kaylin, the system will recognise that the same ID is being given to two individuals. So it will compare and contrast their audits, and it will put that in a feature, and it'll give you a traffic light system on where they're consistent and where there's inconsistencies, and you can increase that to 3, 4, 5, 6 auditors on one plan. So that's just by assigning it to more than one person. Then it doesn't audit the advice beneath the plan, and obviously a plan's only as strong as that advice, but the tool's been designed to get that end product EHCP QA, but it doesn't replace those multidisciplinary QA frameworks or forums where you do deeper dive. The tool signposts where to do deeper dives, has the moderation data, has the audit summaries, but then you would still go deeper dive to say, well, is it how the advice was translated, or was it the quality of the advice? And as a result, that's why the NHS commissioned us to build the health advice tool. We're now building a social care advice tool and a psychology advice tool to have that module supplementing it as well.
Thank you, it's great.
Thank you. Okay. Any other questions? No, it doesn't look like it. So
thanks. Yeah, thank you,
yeah.
everybody.
Thank you very much, Phil and Kaylin, for your really interesting presentation. As I said, we'll post a recording of this up on the website so you can watch it back, share with your colleagues. There is the link in the chat to the 2-minute clip of Knowsley talking about their experience of working within Vision 360. So if you get a chance, take a look at that as well. But all I want to do now is just close up by saying thank you for everyone attending. I hope you found it interesting. Kaylin and Phil, thank you very much for speaking today. And I look forward to seeing you both can see.
Thank you, everybody. Have a good afternoon.
Thank you. Bye-bye.